You will not know when you are experiencing abnormal when you're not sure what normal is. So, what is a normal menstrual cycle? When we look at a normal menstrual cycle, we look at the duration of the bleed, which is expected to be anything between 2 to 7 days of bleeding. We look at the cycle duration, which is the first day of menstruation till the first day of the next menstruation. The time frame in between for most women is usually a 28-day cycle, but the expected or the normal range is anything between 21 to 35 days between your cycles. So, again, we look at the flow. How heavy do you bleed? The expected period amount is anything between 3 to 5 tablespoons per period. So if you are experiencing anything that is outside of these ranges, having heavy clots during bleeding or bleeding every 2 weeks, which is less than the 21-day duration, or not seeing your period at all, or bleeding for more than 7 days, it's a call for concern. Now, what is an abnormal period? When do we say a period is abnormal? 1, it's when the period doesn't show up at all. You miss your period for at least 3 consecutive months. We call that amenorrhea. 2, when the period shows up but untimeously, like after sexual intercourse, that is called postcoital bleed. Or it shows up in between your menstrual cycles or menstrual bleed. So that is untimeous. 3, it shows up but just too much, either too frequently or with heavy clots and heavy bleeding. So again, it shows up but with unbearable, excruciating pain. So those are the 4 common associations with abnormal periods, and those are calls for concern. So keep with us as we're going to be discussing further things as to what causes heavy periods, what causes them to be absent, and what can you do about it. Subscribe and keep watching.